Good afternoon. This is a GCHS-TV News Special Report. I'm Aaron Barker.
And I'm Taylor Gammon.
We are honored today to be joined by a pair of Greenup County alumni, Dr. Nikki Christian and Dr. Rob Hayes. How are you guys today?
Doing well, thanks.
Very well, thanks.
Dr. Nikki Christian is a 2002 graduate of Greenup County High School, a 2006 graduate of Marshall University with a Bachelor of Science in Biochemistry, a 2010 graduate of the University of Kentucky College of Medicine, completed internal medicine residency in 2013, practices outpatient internal medicine / primary care throughout KDMC in Greenup, and is also a wife and mom to 2 daughters, Madeline, who's in 3rd grade at McHale Elementary School, and Olivia, who is 4.
Dr. Rob Hayes is a valedictorian of GCHS class of 2000, earned his MD from the Joan C. Edwards School of Medicine at Marshall University, current medical director and section chief at St. Mary's Hospital, the clinical professor of medicine at 4 schools, considered a subject matter expert in the practice of internal medicine and hospital medicine, and lives in Ashland with his wife Brittany, children Reagan, Carter, and Camden.
So today we're going to be discussing topics such as COVID and the vaccine. Our first question for you guys is, since Pfizer got fully FDA approved, have you seen an influx in COVID-19 vaccinations?
So I would say I have seen an influx in folks wanting to get vaccinated. I'm not sure that it's due to the full approval of the Pfizer vaccine, possibly. But I think it's also true that as more people in our area have gotten sick, more people are willing to get vaccinated because they've seen their friends and family suffer.
Yeah. Which vaccine has proven to be the most effective so far?
Efficacy for all 3 vaccines that we have in the U.S. is excellent. I think it depends on what population you're talking about. Age groups matter, ability to get a second dose matters, but they're all 3 very efficacious.
And one of the main important aspects of the vaccine is to prevent serious disease, to prevent deaths and ventilator use. And all of the vaccines are very effective at doing that.
Okay.
What is your opinion on the COVID-19 vaccine, just in general?
In general, the vaccine is very effective. It manages to keep the severity of disease low. It prevents people from being hospitalized.
Okay.
It's not perfect. No vaccine is perfect, so there are some breakthrough cases. But in general, the vaccine is very effective.
Okay. What is the connection between the COVID vaccine and blood clots in certain individuals?
So there's a couple connections with this. Primarily, it's seen in the more traditional vaccines as opposed to the ones that use mRNA.
Mm-hmm.
It gets pretty technical, but there is some small risk of a blood clot in some of these vaccines. However, Dr. Christian and I were talking about this last night. One of the neat things about the fact that they have found this is that it shows that the process works in terms of monitoring the vaccines for safety. They stopped the use of the J&J vaccine early on when they saw this association, reviewed the data, and then restarted using the vaccine once they realized that the risk was very small.
Okay.
What is the reasoning behind vaccinated people being required to wear masks?
So that's an interesting question. Back in the summer months, we had pretty good data that suggested that vaccinated people were not getting or transmitting COVID-19. More recently, I would say since July, there have been more and more folks that have been vaccinated that are still coming down with COVID-19 symptoms and transmitting it to others. The jury's still out, I think, as far as whether that's a difference in Delta or if maybe we have some waning immunity in people that were vaccinated, 7 or 8 months ago. But I think it's important for everybody to be wearing masks right now in crowds, indoor spaces, or even in crowded outdoor spaces, because even though I'm vaccinated, I may still come down with COVID and be able to transmit it to others.
Yeah. Why can't kids under the age of 12 get the vaccine?
So kids under 12 can't get the vaccine yet, and the yet is important because I think it's coming, but it's really about the data. So the FDA has actually asked for a bit more data in those age groups, just really erring on the side of caution and safety for kids. But I think you'll see that coming in the next few months.
All right.
So looking at the topic of only being able to get the vaccine above the age of 12, why is it only the Pfizer vaccine that the children can get that are above that age?
Again, it's about data. So to have a vaccine qualify for EUA or full approval, the company that makes the vaccine has to submit their trial data. So it just has to do when the company submits their data, how much data is submitted, and that whole process.
Okay. What are, if any, the risks of the COVID-19 vaccine with fertility in young people? I know that's been brought up a few times.
Sure, and that's a good question because there's a lot of concern about that. There seems to be no evidence whatsoever in the literature that suggests there's any concern about fertility in young people.
Okay. Do COVID antibodies in recently infected people that have overcome the virus act the same way as having the antibodies that are inside the vaccine?
Sure. I think, as Dr. Christian just said, the jury is still out on that issue. So there's a lot of studying being done right now on how effective natural immunity is in comparison to vaccinated immunity. What they found is that the best way to prevent COVID is to have COVID and then get vaccinated afterwards. A lot of people wonder, why should I get vaccinated if I've already had the disease? And actually, those who have had COVID and are vaccinated are the least likely people to get it later.
Just because they have the antibodies from both?
From both.
Okay.
Yeah. I think it's interesting too because just because you've had COVID before doesn't mean you're completely immune. I've seen patients that have had COVID in the past, maybe mild illness, and then become quite sick with COVID later. And some people get pretty good immunity from a natural infection while others seem to get very little immunity at all. And there's no way for us to tell that yet.
How many people are in the hospital right now that have had COVID and have been vaccinated?
Well, I've got King Sauter's numbers, so I'm not sure nationally, but I work for King Sauter's Medical Center, and right now we have 56 patients admitted in total, 9 in the ICU. None of the folks that are in the ICU are vaccinated. We actually, unfortunately, had 4 deaths within the past 24 hours, and none of those folks were vaccinated either. Let me see if I can get you an exact number on how many. I think there's maybe 4 or 6 that are in right now that are vaccinated.
How many patients, if being vaccinated does not prevent infection, why are hospitals giving employees the option to either be vaccinated or face harsh COVID testing before returning to work, while vaccinated employees don't require testing but can still spread the virus the same?
So I think it's about level of risk. We know that vaccinated folks are less likely to come down with COVID, they're less likely to have symptoms, and they're less likely to pass it along. Now that risk isn't 0, but it's substantially less than an unvaccinated individual. So we're trying to meet folks halfway and lower their risk. So we're attempting to approximate an unvaccinated person's risk by testing them frequently.
As you said just a second ago, people are better off if they get coronavirus to get the vaccine after it. How long should you wait after you have COVID and have overcome it to get the vaccine? Do you get it right after you overcome it, or is there like a waiting period for it?
I typically recommend 90 days.
Okay. What exactly does the coronavirus attack within your body?
Generally speaking, it can attack almost any organ system. So we certainly know that it affects the lungs significantly in some patients, but it can affect almost any organ system in the body, including the brain and the heart. So it does have a pretty broad effect on the individuals.
Okay. What are the main ways that COVID will spread?
So that's a great question because everyone wants to know, how do we prevent spread? Primarily, COVID is spread through droplets. And so what does that mean? That means when you cough or you speak or you sneeze, droplets come out of your respiratory tract and they carry the COVID virus with them. It also can spread through something called aerosols, which are much tinier droplets, and those can be suspended in the air for a long time and remain infectious.
So that's what the mask goes after to try and stop the aerosols.
It prevents both, actually.
Okay. How confident are you in masks working?
Sure, there's a lot of data out there on masks, and the vast majority of the data does suggest that masks are effective at reducing the risk of spread. And actually, in just the last few days, some large-scale data has come out suggesting that it's very effective.
How many people under the age of 18 have died of COVID?
I have those numbers as well. I believe there have been 2 patients under the age of 18 in Kentucky die of COVID-19, and then I've seen a range from 425 to 470 pediatric patients nationwide.
What are some of the long-term effects of COVID-19 with adults and children?
So I'm an internist and I take care of adult patients, so most of my clinical experience is with those 18 and up. In my patients that have recovered from COVID-19, most of the complaints that I hear are things like brain fog, difficulty with thinking. The fatigue is probably the biggest component. The fatigue just seems to linger and linger. And then shortness of breath, too, is a common complaint weeks to months later.
Generally, do you think they would be the same between adults and children, or do you think it would vary?
I would imagine they would be similar. I think the fatigue is probably one of the more common symptoms.
Okay.
So as we see the Delta variant, and there's even one now called the Lambda, what causes the variants to manipulate and turn into them from the original strand?
Do you want the simple answer or the science answer?
Science answer.
All right, very good. I like it. So viruses have, their genetic material can be DNA like ours, or it can be RNA. RNA is particularly fragile, and then viruses also don't have the repair mechanisms that our cells have. So if cells in my body receive damage of whatever type, my cells will have repair mechanisms that can go through and patch those or repair those. Viruses don't possess those repair mechanisms. So when their DNA is damaged, then that damage carries through, and that may make them better at their job, or it may make them worse at their job. But you would imagine that if it's a change that makes them more infectious, you're going to see that spread further in the population.
And with millions of people having the virus and replicating the virus in the bodies over and over all day, every day, the likelihood that some major change is going to happen is very high. And so it's very likely to be seeing these emerging variants occurring on a regular basis.
And out of all of them, which one do you see the most serious?
Right now it seems like Delta is not only serious because it may cause more severe disease, it's certainly more transmissible, but it's also the #1 variant circulating right now.
Okay.
If COVID-19 and all these new variants coming out are supposed to be so dangerous, do you think schools are really a safe space for students and faculty members?
That's a hard question to answer, and it's being debated across the country right now, and people feel very strongly on both sides of this, and for good reason. I think everything in life is about weighing risk versus benefits. Obviously, in-school education is invaluable to our students, my daughter included. So I think school can be done in a way that is safe enough that the benefit outweighs the risk. So if we do things right and those over 12 are vaccinated, we wear masks, we have distancing, we have sanitization protocols. If we can do activities where masks need to be removed, like eating outside, things like that, then I think we can do school safely.
Okay. Why do certain groups of people catch COVID-19 easier than others?
So as far as catching COVID, I don't know that we have an answer to that. And there's lots of things with this disease that we just don't have an answer to yet. So if the question is, why in one household do 3 members get it and 1 doesn't, I don't know the answer to that. Maybe it's genetic differences, maybe it's complete luck, I don't know. But it's pretty clear that some people are more affected by the virus than others. And that has a lot to do with, prior to Delta, it had a lot to do with comorbidities and age. With Delta, that doesn't seem to be as big of a factor. We're hospitalizing younger and younger folks. There are younger and younger people requiring ventilator and ICU care. So I think the assumption that COVID was a disease that was really harming the elderly is not really correct anymore.
Yes.
Do you guys have anything else to add that we did not touch on?
I think that we would encourage everyone to talk to their family doctors about their own medical care. It's very important that if you're a candidate for the vaccine, that you take that very seriously and consider whether or not it's right for you. We recommend it for the vast majority of people that they have the vaccine. So this is the number one way to prevent the spread of this disease. And it's very effective, and the studies have all shown that it is reasonably safe.
All right.
So upcoming here at Greenup County, we have a vaccine clinic. If coming up on the screen is a graphic explaining information about that. It'll be a walk-in clinic from 3 to 7 near the ROTC building. So come on out to that if you're looking to get vaccinated. That will do it for this GCHS-TV special news report. We'd like to thank Dr. Hayes and Dr. Christian for joining us. Thank you to all of our viewers. For GCHS-TV, I'm Taylor Gammon.
And I'm Aaron Barker.